Yeah, it's an FMG question. Yeah. So look at this one. So 20-year-old patient. 20-year-old patient has fever, severe shortness of breath, and red currant jelly stools. On examination, he has altered sensorium, respiratory of 35. Okay. And lab investigation show creatinine of 1.9. They are not given the urea. Chest X-ray is done show multi-lobar infiltrates. And patient is also having what? Altered sensorium. This is the exact question that came. So what is correct regarding the management? So actually, this patient should be going to ICU straight because you have the three minor criteria: altered sensorium, tachypnea, and multi-lobar infiltrates. So patient must be in the ICU, ideally. So here, it's literally impossible to calculate the curve 65. Can you calculate curve 65 here? First of all, you don't have the data. So anyway, even if you give confusion 1 point, respiratory rate 1 point more than, they're not given the BP. Okay, they're not given the BP at all. Age is anyway gone, 65, and they're not given the urea values. Uremia they have not given. So you don't know how can you first of all calculate the curve 65. Do you understand? Are you understanding or not? Without data, how can you even calculate curve 65? So if you say the score is only 2, if you say only the score is 2, I mean based on the given data, where will you put the patient according to this question? In case if you have done only the curve 65, you will put the patient in IP. So imagine logically, think logically, a person who's having multi-lobar infiltrates, altered sensorium, and severely tachypneic, you want to put the patient in what? Even the staff nurse will kick you out. They will not take the patient in the ward. If the patient is in altered mental status and if the patient is having severe tachypnea, you think the staff nurse will allow you to keep the patient in what? With high flow oxygen? 100% not possible. So logically, this is not there. Plus at the same time, so this is based on certain things. I'll tell you what. So remember, so this is the exact thing I told. So this is from Harrison actually. I told you yesterday, whatever I speak will be from Harrison or some common textbook or some article. That's it, nothing else. So Harrison clearly states what neither PSI or curve 65 is accurate in determining ICU admission. Okay. So accordingly, we have to follow the IDSA. There is not IDSA criteria that's given here. So what they have given is, if you have any of the major criteria, the patient is in septic shock, requiring vasopressors, or if the patient is in respiratory failure requiring intubation or mechanical ventilation, then should be straight away admitted to ICU. Or if the patient is having 3 of the 9 minor criteria listed in table 126.3, they said that you have to put the patient in the ICU. So here, whatever criteria I told you will be there. I told in curve 65 order first. So the altered mental status will be there. Respiratory more than 30, POT FAT ratio of less than 250, multi-lobar infiltrates, uremia, burn-off more than equal to 20, WBC less than 4,000, thrombocytopenia less than 1 lakh, hypothermia less than 36 degrees Celsius, and low BP requiring fluids. So if low BP is requiring vasopressors, then it's a major criteria. If low BP is requiring fluids, IV fluids alone to maintain BP, then it will be a minor criteria. If they say 3 or more of the minor criteria means the patient should be in the ICU. Are you understanding why this question is not that easy? Like what do you think? Yes or no? So this is actually from Harrison. I'm not saying any other fancy textbook. It's straight from Harrison. It's there in the first page of community-acquired pneumonia management. So that they have given a table, and examiner is easy to pick up the tables, right? So examiner has done nothing. He has just seen the pneumonia topic and he has just taken the information from the table and they have framed the question. That's it. Nothing else.